As we cross the age of 50, our body begins to change in ways that are silent but significant. One of the most overlooked areas is the glute muscles, the largest and most powerful muscles in the human body. Weak glutes are not just a fitness issue. They are a medical concern that affects balance, posture, joint health, and independence in later years. Today, this discussion focuses on senior health secrets that can protect mobility and restore strength through 5 essential glute strengthening exercises. After the age of 50, the human body undergoes natural physiological changes that directly affect muscle strength, balance, and joint stability. One of the most important yet commonly neglected muscle groups during this stage of life is the gluteal muscles. These muscles form the foundation of lower body movement and play a vital role in everyday activities such as standing, walking, climbing stairs, and maintaining balance. When glute strength declines, the body begins to compensate in unhealthy ways, placing excessive stress on the knees, hips, and lower back. Muscle loss after 50 is a medically recognized process. Without regular activation, the glute muscles weaken faster than many other muscle groups due to prolonged sitting and reduced physical activity. Weak glutes alter posture and disrupt proper walking mechanics, often leading to chronic pain, stiffness, and fatigue. Over time, this imbalance can contribute to degenerative joint conditions and reduced mobility. Glute strength is also closely linked to balance and fall prevention. The glutes stabilize the pelvis and control movement during walking and standing transitions. When these muscles are weak, balance becomes unstable, increasing the risk of falls, which are a major cause of injury among older adults. Strengthening the glutes helps improve coordination, reaction time, and overall confidence in movement. In addition, strong glutes reduce the workload placed on smaller, more vulnerable muscles and joints. This protective function is especially important for individuals experiencing knee pain, hip discomfort, or lower back issues. By restoring proper muscle engagement, glute strengthening can naturally alleviate strain and improve movement efficiency. Maintaining glute strength after 50 is not about athletic performance or aesthetics. It is a cornerstone of functional health, independence, and long-term quality of life. Strong glutes support upright posture, safer movement patterns, and the ability to perform daily tasks without fear or discomfort, making them essential for healthy aging. As people move beyond the age of 50, maintaining balance becomes one of the most critical factors in preserving independence and preventing injury. Balance is not controlled by the feet alone, but by a coordinated system of muscles that stabilize the body. With the glute muscles playing a central role, the glutes support the pelvis and hips, which act as the body's center of gravity during standing, walking, and transitional movements such as turning or rising from a chair. When the glute muscles weaken, the pelvis becomes unstable. This instability disrupts walking patterns and slows reaction time. It's making it harder to correct the body during sudden movements or uneven surfaces. As a result, even minor missteps can lead to dangerous falls. Medical data consistently shows that falls are one of the leading causes of fractures and long-term disability in older adults, and weak hip and glute muscles are a major contributing factor. Strong glutes improve lateral stability, which is especially important for preventing sideways falls, the most common type of fall in seniors. These muscles help control side-to-side movement and allow the body to respond quickly when balance is challenged. With improved glute strength, individuals are better able to regain control if they trip, slip, or lose footing. Glute activation also enhances communication between the muscles and the nervous system. This improved neuromuscular coordination leads to faster reflexes and smoother, more confident movement. Over time, individuals notice greater stability when walking, climbing stairs, or standing on one leg, all of which are essential for daily living. Strengthening the glutes provides a protective advantage that goes beyond muscle power. It builds confidence in movement, reduces fear of falling, and supports safer mobility. By reinforcing this crucial muscle group, older adults can significantly lower their risk of falls and maintain a more active, independent lifestyle. For individuals over the age of 50, Exercise selection must prioritize safety, joint protection, and effectiveness. The goal is not intensity, but correct muscle activation and consistent movement. The 5 essential glute exercises are designed to strengthen the muscles without placing excessive strain on the knees, hips, or lower back, making them suitable for older adults with varying fitness levels. Glute bridges are one of the safest ways to activate the glutes while protecting the spine. Performed on the floor or bed, this exercise strengthens the hips and lower back while improving pelvic stability. Chair squats mimic the natural movement of sitting and standing, reinforcing proper mechanics and improving functional strength needed for daily activities. They help train the glutes to support body weight safely and efficiently. Supported lunges or step-back movements allow controlled glute engagement while minimizing stress on the joints. Using a chair or wall for balance ensures stability and reduces the risk of falls. Standing leg extensions activate the glutes in an upright position, improving posture and coordination while strengthening the muscles responsible for walking. Side leg raises target the often neglected side glute muscles, which are essential for balance and hip stability. Each of these exercises can be modified to match individual abilities. Repetitions can be adjusted, and movements can be slow and controlled to reduce injury risk. Proper breathing and posture during these exercises further enhance safety and effectiveness. When performed consistently, these movements restore muscle function, improve joint support, and increase confidence in daily movement. The simplicity of these exercises allows them to be performed at home without special equipment, making them accessible and sustainable. Regular practice leads to noticeable improvements in strength, stability, and overall mobility, supporting healthier aging through safe and effective physical activity. Chronic pain in the lower back, hips, and knees is one of the most common complaints among individuals over the age of 50. In many cases, this discomfort is not caused by damage alone, but by improper muscle activation. When the glute muscles become weak or inactive, the body shifts the workload to smaller muscles and joints that are not designed to handle it, leading to inflammation, stiffness, and persistent pain. The glutes play a critical role in supporting the spine and controlling hip movement. When they are not functioning properly, the lower back often compensates, resulting in muscle tension and strain. Similarly, weak glutes allow the knees to collapse inward during movement, increasing stress on the joint and surrounding tissues. This imbalance can worsen existing conditions such as arthritis and contribute to daily discomfort. Proper muscle activation restores natural movement patterns. When the glutes engage correctly, they absorb impact and distribute forces evenly across the body. This reduces pressure on the joints and allows movement to feel smoother and more controlled. Many individuals experience noticeable pain relief simply by learning to activate the glutes during basic movements such as standing, walking, or climbing stairs. Targeted exercises that focus on slow, controlled glute engagement help retrain the nervous system and improve coordination. Over time, this leads to improved posture, better alignment, and reduced muscle tension. As the body begins to move more efficiently, reliance on pain medications often decreases. Pain relief through proper muscle activation is a natural and sustainable approach. By strengthening the glutes and teaching the body to move correctly, older adults can reduce discomfort, protect their joints, and improve overall quality of life while maintaining safe and functional movement. When beginning a glute strengthening program after the age of 50, many individuals wonder how quickly they will notice changes. While aging does slow certain biological processes, the human body remains highly responsive to proper movement and muscle activation. With consistent and correctly performed exercises, early improvements can often be felt within the first 2 to 3 weeks. These initial changes usually appear as reduced stiffness, easier movement, and improved comfort during daily activities. Strength gains do not happen overnight, but neuromuscular adaptation occurs relatively quickly. The nervous system learns to activate the glute muscles more efficiently, allowing movements such as standing up, walking, or climbing stairs to feel smoother and more controlled. This early improvement often boosts confidence and encourages continued participation in exercise routines. Within 4 to 6 weeks, measurable strength improvements typically become noticeable. Individuals may find it easier to rise from a chair, walk longer distances without fatigue, or maintain better posture while standing. Balance and coordination often improve during this stage, further reducing the risk of falls and instability. Consistency is more important than intensity. Short sessions lasting 15 to 20 minutes, performed 3 to 4 times per week, are sufficient to produce meaningful results. Overexertion can delay progress by increasing soreness or risk of injury, while steady, moderate effort supports sustainable improvement. Progress may vary depending on existing health conditions, activity, history, and adherence to proper technique. However, age does not prevent positive change. With patience and regular practice, strength, stability, and mobility continue to improve over time, reinforcing the value of safe and focused exercise as an effective tool for maintaining physical independence and functional health. Investing in glute strength after the age of 50 is one of the most effective long-term decisions for preserving health and independence. Unlike short-term fitness goals, strengthening the glute muscles delivers benefits that extend across multiple body systems and support daily function for years. These muscles serve as the foundation for movement, posture, and balance. Influencing how the body ages over time, strong glutes help protect the joints by absorbing impact and controlling movement. This protection reduces wear and tear on the hips, knees, and lower back, slowing the progression of joint degeneration and discomfort. Over the long term, this can help delay or prevent mobility limitations that often accompany aging. Improved posture is another lasting benefit, as active glutes support spinal alignment and reduce the strain caused by prolonged sitting or poor movement habits. Glute strength also plays a role in cardiovascular and metabolic health. When large muscle groups are engaged regularly, circulation improves, and overall physical activity becomes easier to maintain. This supports healthier blood sugar levels, weight management, and energy balance. Increased strength encourages a more active lifestyle, which further reinforces long-term health outcomes. Maintaining strong glutes supports independence by preserving the ability to perform essential daily tasks such as walking, lifting, bending, and standing without assistance. This functional strength reduces reliance on others and contributes to emotional well-being and confidence. The psychological impact of feeling capable and stable cannot be overstated. Consistent glute strengthening is not about pushing physical limits, but about building resilience. Over time, this resilience supports safer movement, sustained mobility, and a higher quality of life. Small, regular efforts accumulate into lasting physical security, making glute strength a powerful and worthwhile investment in healthy aging. As we come to the conclusion, it is important to remember that aging does not mean surrendering strength, mobility, or independence. After the age of 50, the body may change, but it remains capable of adapting, rebuilding, and becoming stronger when given the right stimulus. The glute muscles, often overlooked, are central to this process. They support balance, protect the joints, stabilize the spine, and allow everyday movements to be performed with confidence and control. The 5 essential exercises discussed are not complicated, extreme, or risky. They are practical, safe, and designed specifically to support senior health. When performed consistently and with proper technique, they help restore natural movement patterns, reduce unnecessary strain on the knees and lower back, and significantly lower the risk of falls. More importantly, they empower older adults to move without fear. Real progress does not require long workouts or heavy equipment. A small time commitment practiced regularly can lead to meaningful improvements in strength, posture, balance, and comfort. These improvements accumulate over time, creating lasting benefits that extend well beyond physical fitness. This approach to health is not about chasing youth, but about protecting quality of life. Strong glutes support independence, dignity, and the ability to remain active in daily routines. By making these exercises a regular part of life, individuals over 50 invest in a safer, more confident, and more capable future. The message is simple and powerful. Movement is medicine. Consistency is key, and strength at any age is achievable with the right knowledge and commitment.